faith-fueled, helping you to become the wise divine women that you've been called to be. Today, we have Cindy Dupuis from California. Hopefully it's warmer there than here. And it's a living balance. And as you know, I'm always about talking what's passionate upon your heart. And so that kind of threw Cindy for a loop. So I'm looking forward to the show. Welcome, Cindy. So what brought you on this path of helping women in perimenopause and menopause? And I'm sure it's just not that, because I think you're post-menopause as well. So we were just about to jump into a really great topic, but I'm going to let you go. How did you start?
Okay. So how I started was once upon a time. No, long time ago, I received my degree in dietetics and food administration. And so I've always been fascinated by the body because it's just so amazing how it works, along with the mind, everything, and how it's all connected. And once I got my degree, I didn't do anything with it. I got married, I raised a family, I worked for my then husband in the used car business. So a little bit of a detour. And then when I was about 43, I was going through a divorce, and which is a big upheaval, and I was kind of a mess, and my digestive system was really a mess, and I was trying to get some help, and I wasn't getting any from Western medicine. And along with that, I also wanted to get back into the body somehow, helping people. And I'm like, what can I do? So I'm thinking about basic nutrition. And lo and behold, I found Dr. Mark Hyman, and that was 25 years ago. So that was quite a ways ago, and stumbled upon functional medicine through finding him. And then the Institute of Functional Medicine had an intensive 7-day training, 6-day training out here in Pasadena, California. And I said, I got to go. So I paid my money and I went. In amongst all that, I threw myself in menopause at the fairly young age of 43. And I did that because I was totally stressed, and I lost too much weight. And when you lose that much weight, your body just says, excuse me, we don't have fat or cholesterol to make your hormones. And even when I kind of came back, which actually took me about 2 years, maybe even 3 years, to kind of settle all the way down, not all the way down, but a significant amount. My body at 45, 46 just said, what's the point? We're not going to, come back on board here. And so I have been in menopause this time I was 43. So
it's a long time. Well,
yeah,
it started very early. Yeah, that's very early.
yeah, it is on the early end of it, definitely, because the average age is about 51 in the US. So I think Canada as well. So from there, after discovering functional medicine, in the Institute of Functional Medicine, I thought, I have found my tribe. This all makes so much sense to me. And I got really excited, and I started taking more courses. And at the same time, I also became a yoga instructor. And that was definitely for me. But it was also at that point wanting to give back and be a part of other people's healing, because I think if I hadn't had it, I don't know what I would have done during that period. Yeah.
Right.
So meeting wonderful people through my students' classes, people started to come to me to have them help me with their health and nutrition. And so I'm digging as fast as I possibly can as people are coming to me. Our clients are our biggest teachers. We are, but our clients are too. I mean, they constantly challenge us. It's like, oh God, I got to find out about this. So, so that was kind of my journey. And I was helping both men and women. And then and especially in the realm of gut and digestive health, I'm definitely, that's kind of my lane on top of perimenopause and menopause.
Right.
So What happened about 5 or 6 years ago, so right before everything took off in the realm of menopause and perimenopause and everything on social media, I was kind of looking at my clients and my cohorts. Okay. So I'm going, my clients who I knew how they ate, I knew their lifestyle, I knew their guts, I knew their overall health. I'm going, we're still losing some ground here. So I better look at this a little bit more closely. And then my contemporaries, same thing. I'm looking at them going, they're in the doctors a lot. They don't feel good. They're in a lot of pain. They're beginning to be put on many medications. And I, fortunately, don't know how it happened. I got really lucky. And that about 7 years out of going into menopause, so when I was 50, I met up with a naturopathic doctor, and I don't even know why I didn't ask for it because I didn't know to ask for it. We didn't talk about these things. We don't talk about menopause and HRT at this point in time, because I actually went into menopause right after the Women's Health Initiative study. So all conversation, all training, all that is done out the window for over 2 decades. So anyway, this wonderful doctor put me on hormones, bioidentical hormones. And it was a low dose and it was the biased. So a
Mhm.
very weak, you're shaking your head, so you probably know what that is.
Yeah. Yeah.
So it's actually a very weak form of hormone replacement, but it still was beneficial. And I was on that type of hormone replacement up until about 5 years ago, after I started really digging into all the things that hormones can do for us, really how it can help women. And I decided to change type of hormone I was on. And I'm glad I did. And it's made a difference.
Yeah.
But that's what got me into it. It's just watching what was going on around me, going, okay, there's a piece that we're missing. And, prior to me digging into everything about 5 or 6 years ago, I would ask the cursory question because this is how we thought of HRT back then. Maybe hot flashes, maybe helping with that, but how it pertained to libido. So I'd ask my women, so how's your libido? And if they said it's tanked, it doesn't exist, but I don't care because either I'm not in a relationship or my husband doesn't want sex anymore.
Yeah.
And, that was kind of eye-opening to see how much I got of that too. And I'm going, oh my goodness. And so I would end the conversation there because I
Yeah.
was naive in the far-reaching benefits and effects that our hormones have on our bodies.
Right. Right.
Yes,
And it was so much when you had said you stop it, I was kind of like, why?
I
Because it's
know.
really important, right?
Yes.
And I'm was so excited. I've been driving around Ontario for work, which I do thermography, so I've been traveling.
Ah,
And then the Estrogen Matters has just been re-released with all the updates. So I have been diligently listening to that. And that's my first question when I'm talking to my clients. I'm like, where are you with like, how are you with hormones? Do you want to open
okay.
that conversation? Let's start talking about it one to one here, and let's see what your thoughts are about it, because it's so important.
It is.
It's so important for men too. And this is a conversation that we
Yes.
need to be opening up, because at 50 and 60, even 70 years old,
Mm.
everyone should still be like vibrant,
Mhm.
right?
Mhm. Mhm.
And it's not about libido
No.
anymore. And I think the research is really showing that, yes, our body is supposed to be making the right amount of hormones for the right amount of our age. We still produce hormones, but they're so low with all of life, it's just not working. And so that's it. Like, there's so many women, their blood sugars or their bone densities
Yeah.
and their heart health, and they're on all these
Mhm.
medications. And I'm
Mhm.
just like,
Mhm.
has anyone talked to you about hormones? This is
Mhm.
a really important conversation. And
Mhm.
you still have to keep that conversation open and positive, and point them in the right direction of research,
Yeah.
so that they can educate themselves to educate their doctors,
Yes.
right? Or at least connect them to the new services. Like we have an online, uh, I'll say dispensary, but it's Science and Humans here in Toronto that do all of that. And then you have as well in the States, you have so many people that are so up to date
Yeah.
now with hormone replacement. I think it's important but to find the right one, of course. So
Yeah.
yeah.
You would think it would be easier than what it is. I mean, we have online, we have access to,
Yeah.
MIDI Health, Joy. We have access to a lot of online hormone companies and peptide companies and all of that. And it's unfortunate that we're kind of reduced to going there because that's the only way that we can get help. But the problem with that is that they're not really monitoring the woman, okay? Not really the way that she needs to be monitored. And if her doctor
Right.
doesn't understand what she's on, what it's for, what it's doing for her, she can't get that support. So there's still such a dearth of knowledge out there amongst the healthcare professionals who
Yeah.
can actually prescribe. And I'm running into that personally as well, and it's daunting. It's really daunting. It's funny, and I do want to talk about that a little bit. But I was just listening to a podcast, the Dutch podcast. Are you familiar with the Dutch test?
Jennifer Simmons. Did you
Oh, I
just
didn't
listen to
listen to
that?
her, but I know her
Yeah.
very well. I know Jen very,
Okay.
very well. But there was one before that. I know that's on my, I mean, there's so many, right? To listen to.
Good stuff.
Yeah, but they were interviewing a doctor who does pain management. That's where he comes from. And he's gotten into the longevity space. And, there's so, longevity space means so many different things, right? So, mm, how he kind of got into that is from the pain. And what he was seeing is that the women who were on HRT responded so differently to the different types of protocols that they would put their women and men on, right? Going back to that, that he went, oh my goodness, I have got to learn about hormones. And so he has. And so
Hmm.
that's the longevity part of it is that, I think men want to live as long as they can, and women just want to live gracefully and feel good. Isn't that
Yes.
it's so
Yeah.
funny? He mentioned that one. God, that's true.
Yeah.
It's like men want to win, right?
Yeah. But it's just so it's interesting now that that floodgate has been opened, right? And that conversation has happened.
Yeah.
When we step back and look at what the symptoms are there, and then yourself as a functional medicine practitioner, myself as
Mhm,
a FDN, we get to really sit back and look at the test, look at the
mhm,
different things that are
mhm,
involved,
mhm,
and gut matters to hormones.
mhm,
It's
mhm.
so
Well, and
foundation.
it's
So
fan yeah,
yeah.
and hormones matter to gut. And I know I hear a lot about how gut matters to hormone and the metabolism and all of that, and that's very, very
Mhm.
true. But I don't hear a whole lot about how our hormones affect our gut. In fact, do you know who Karen Martell is?
The whom, I'm sorry?
Karen Martell?
No.
Oh,
I'm gonna write her name.
you're gonna like her. You're gonna
It's a
like her.
you can't have one. I get what you're saying. You can't have one without the other.
No,
It's a
and
balance to things, right?
it is a balance. And what I think most women do not, and practitioners do not realize is that estrogen affects every single cell, tissue, and organ in our bodies. It affects our
Yeah.
mitochondria. Okay. It affects our blood vessels, so high blood pressure. It affects our gut. It affects our joints, our ligaments. It affects our brain. It affects every single joint or every single body system in our bodies. And we're still reducing it down to libido and hot flashes and maybe and sleep. right? And it's so much bigger than that. And until
It
we
is. It is.
understand that and understand exactly how it affects all of these body systems, I don't think we can get a bird's eye view and get out from underneath, you know, still this narrative that's still going on that I'm running into with my I have a doctor I go to for hormones. I'm trying to work within my HMO and it's like, "Oh my god." And
Yes.
I know what to ask for. I know what to push for. And so the women that don't, it's it's heartbreaking to me. And
Well,
it's
that's where they need you,
they
right?
do.
And it's so important that if you're looking for HRT to
Yeah.
connect with someone who is
Yeah.
more integrative and functional,
Yeah.
to pull the pieces together, understand symptoms
Mhm.
as it relates to what you're feeling, but what we also see in test results outside of just your normal uh, primary,
Mhm. Mhm.
and then how you're responding, because to me it doesn't matter what peptide you're taking or what hormone you're taking. If you don't have a foundation built, if you're not managing your stress,
Yeah.
if your gut is leaky,
Yeah.
you're not pooping, your hormones are going to work, right?
They they aren't going to work. You're dead on correct. You're dead. And I actually even talk about this, and I have on my Instagram. I had AI make a
Yeah, yeah,
cake,
yeah.
a layered cake, because I say the HRT. Although I've changed how I word this, my verbiage. The HRT is the icing on the cake, just what you were
Mhm.
talking about, and that we need to have all those other layers in place, and we do. But sometimes a woman needs to have a little bit of hormone on board so she can get the other things in place.
The
I used to go,
function.
we're layering up, but no, no, we need to change that a little bit.
Yeah,
So
I
that
love that.
narrative a little bit. But yes, you can't just slap HRT on, just like we can't just slap medication on something. We have to look at the root cause. We have, because everything is all connected. So yes, you are completely right on board here with me.
Yeah, it's funny because I'm always reminding people, like when I'm saying, start having that conversation with your medical doctor. Like if you can get blood work, I know blood work's not the best, but at least it gives a snapshot in time what you're working with. And I'm telling women at 40 to do this, or even at 35,
Yes. Yes.
because have an idea, have a snapshot in time. Like, of
Yes.
course, we can do the testing, but ask your doctor first. Have these
Yes.
beautiful conversations, because a snapshot in time is going to prepare you for what's ahead.
Mhm.
And then you can come at things a little differently. And even the conversation with people, even just for general checkups, right?
Mhm.
What did you have? Did they test your thyroid? Did they test your
Mhm.
liver? Have you done
Mhm.
like what? And they're like,
Mhm.
I don't know.
I know.
I'm like,
And
stop.
I know, and that's a whole nother really important piece. And
Yeah,
I felt it was so important that I've actually made a downloadable PDF, and it is a lab checklist for women in their pause years, because there are specific labs that we need, and I go into that and why and how to ask for it.
beautiful.
Here in the US, it's really easy to get whatever we want, paying out of pocket.
Mhm,
And it
mhm.
does depend on the doctor whether or not they will order it and perhaps insurance will cover it. So, you know, our insurance paradigm is different in Canada, obviously, and here too.
It is. It
It
is.
is. It's very different. So you have to kind of weigh what can you get, what can you have paid. But I mean, we can order even a very thorough workup for maybe 225 bucks here. Okay.
Yeah.
And thorough thyroid, thorough metabolic, thorough nutrient. I mean, there's so many things that we can do. So it's kind of like there's no excuse here in the US. Sorry, there isn't.
There's not. But here in Canada, there are some private clinics with naturopaths who can order blood work. And then people think it's a lot because we're very used to having Health Canada or
Yeah.
that type of idea pay for
Yeah.
everything.
Yeah.
And I'm always like, just have the conversation,
Mhm.
see what you can get. You have to
Mhm.
maybe pay for a vitamin D test. You maybe have to pay for this or that, but have that beautiful conversation. And I think because a lot of doctors aren't up to the same speed and as in an integrative or functional sort of
Mhm.
coaching. So I'm always
Mhm.
like, make sure you're just talking with them from the sense of I'm changing my nutrition, I'm trying
Mm.
to change my exercise for longevity, and this is why I'm asking these things, right? So it's all, and I really believe that people should just be not so hard on their doctors and just be so kind. They're only doing their jobs. They're brilliant. They're brilliant. They
You
can't do what you think they can do. So,
Yes, and, I can just tell, just talking to you, your approach is a very kind and generous approach, and can you imagine a couple things? One is their workload is tremendous,
terrible.
and I wish they had the time and the bandwidth, okay, the
Mhm.
energy and the bandwidth to learn the things that they should. It'd be nice for them to know and to learn, okay, that they're way behind on because
And that's not their fault, but it's
it's
just
it
yeah.
is what it is, and then you have all of us who are coming in and we're in chat and Google, and they have to deal with that now every day. Can you imagine the patience it takes
Yeah.
for them to have to deal with that? And so, yes, being kind and going back to kind of what I'm up against right now, and I'm kind of on the bandwagon for this, is so I'm 68 and I've been on HRT for 18 years now. There is no way in hell I'm going off my HRT. So I walk into my new doctor's office, she's a DO. I picked that because I figure, okay, she's got a broader range. And the first thing she says to me is, she goes, "You're on HRT?" And I said, "Yes." And she gave me this face, and I went, "And I'm not going up?" And I realized, okay, so we have some groundwork to lay here. And, we went through our whole deal, and we came away with there's some, tests we want to do, blah, blah, blah. I did email her a message, said, because I felt really strongly about this. I said, I know we don't see eye to eye on HRT, but it's really important to me for my doctor to be on the same page with me, at least support me. So if that's not something that we can do, then we need to have a discussion about that, and we'll part ways. And I even sent her, I don't know if she read it. I even sent her a copy of the NAMS, North American Menopause Society, their last official statement, which was
Mhm.
all the way back in 2022, but still it's fairly recent, just to give her something. Now, her premise for me going off of HRT was heart disease. So in women over 60, 65, that's what they're more concerned about than cancer. It just kind of depends on
But
the
isn't
history.
that hasn't it
Mhm.
like so yes, women isn't it that is what I understand after a few like some interesting podcasts and I'm listening to the book. If you start HRT later, that's where it becomes a risk, but not if you've been already on it within that timeline, correct?
Okay. I'm so glad you brought that up. Yes and no. Okay.
Right.
Yes and no. Okay. So true, you get the most amount of benefit from HRT, our hearts and our bones, in our head too, but in particular, our hearts and our bones, okay, within the first 10 years. That is legitimate. Okay. Now, with bones and with heart, with everything else, we still continue to get that benefit as long as we're on the HRT. Now, where the HRT and heart comes into play is, again, from the Women's Health Initiative. Okay, so from that infamous study back came out in 2023. And the big thing, if women are not familiar with this, or men, if you're listening to, is that why they stopped the study was that one group, one arm of the study, the group that was on estrogen and progestin, not progesterone, they showed just a tiny, tiny, actually insignificantly statistical increase in breast cancer and cancer. Okay. They've been backpedaling that the whole time. But in amongst that, too, they found that it did not decrease the risk of heart disease and maybe even slightly raised it. Now, the thing to understand here, there's two, maybe three things to understand. The I was going to say the biggest, but probably two equal. One is the average age of the woman that was in the study was about 62, 63 years old. So it was about from age 50 up to 70, maybe even 9. Okay. So your average
Mhm.
age is well outside of that 10-year period when it would be best for a woman to have been on hormone replacement.
Yeah.
So these are women who have not been on HRT, okay? Probably they have inflammation. They could have already had existing heart disease. They could have had already existing cancer. Who knows? They weren't
Mhm.
screened for that. So we have an older women population, okay? That's one. Number two, maybe even more important or just as important, is the type of hormones that they were using. They were not bioidentical. Okay, the estrogen was estrogen from mare's urine, pregnant mare's urines.
Mhm.
Okay, that's not bioidentical to our hormones at all. Okay,
Yes.
and we don't use that. I mean, it's available still, but God forbid a doctor uses that. It's like, really? So we have bioidentical hormones. That was okay. The other thing is that it was oral. All right. So when we take oral estrogen and even oral bioidentical estradiol, there can be a slightly higher clotting risk factor. Okay, there can be because it has to go through the liver that pass. But we have all sorts of transdermal gels, creams, patches, all right, that is delivery form. So for her to comment on that, and then for her to comment a second time when I went and saw her another time, second time follow-up. And by then, I had had a full heart workup because I have had arrhythmias and some palpitations and things like that, and I just like, "Okay, let's just take a look." And my dad has a pacemaker. "Let's just take a look." Like,
Mhm.
let's just look at it. So they did. I got a clean bill of health. So she's got that information in front of her now. I am more concerned about inflammation markers than I am anything else when it comes to
Yeah.
heart disease. All right. My inflammation markers are perfect, but we're still having this conversation. And, a doctor actually who had me on our podcast just recently kind of shed some light. It's just a reminder. And that is that if a doctor is uncomfortable, okay, he or she wants to do no harm, number one. Number two, he or she wants to cover their butt. Okay. If they're not comfortable, they're not going to be prescribing something. So the where we ended with this, almost ended, was that she was going to send me to, I thought it was endocrinologist. She's sending me to OBGYN, which I haven't gone to yet. And if they will prescribe the hormones, okay, then she's okay with it, as long as she doesn't have to make that decision and also monitor it because she doesn't know how. I said, okay,
Right.
fair. I'll go with that. Um, the interesting thing is just because of this whole conversation. So, two things. One is women over 60, especially over 65, are constantly told no, or they're never offered hormones.
Yeah.
I see so many women that come in with reoccurring UTIs, with bones that are crumbling. And estrogen was approved by the FDA here in the US in 1975
Mhm.
to prevent osteoporosis. Okay. And you can also help turn that osteoporosis around too with the help of estrogen and progesterone and testosterone, by the way.
Mhm.
So these women are never even offered. There's not even a conversation. And so she'll suffer, right? She's up against it. And again, HRT isn't the end all be all, but it's definitely an important part of the piece of the puzzle. And I'm seeing that over and over and over
Yeah.
again.
Yeah.
And I just want to say this is the ironic part about this whole conversation I was having with the doctor. I had also sent over my DEXA scan to her that I had done a year or two ago, which, by the way, is done too late here in the US. I don't know where it is, Canada.
Oh, it's 60.
Okay, it's 65 here, unless you
Or
ask for
I'm
it.
saying 60, it could be 65, but you can't. And there are maybe a private clinic down in the Toronto area, but it's so hard to get in. So
Mhm.
yeah,
Come over the
yeah.
border and get your
That's what I
DEXA
tell
done.
them. I'm
Yeah.
like, you want an ultrasound? Just go across the border.
Yeah, just go
Just
across the border. It's like $100 and it's well worth it. You need to know where it is. You need to know where it is, in your early 40s, so you have a baseline, and then you
mhm.
get it then get done every so often. And also
Yeah,
know the risk factors that contribute to osteoporosis other than just losing your hormones and you're going into menopause. There's other risk factors too.
yeah.
But the ironic part about this is as this cute little doctor was leaving the room after our second conversation, where she agreed, if someone else approves it and puts me on it, she's fine with it. She smiles at me and she says, I looked at your DEXA. And I said, yeah, because I have great bone
Yeah.
density. It's great. And she smiles at me and she says, that's your estrogen. And I just went, okay, okay, what did I just hear? And why can't we connect any of the dots? I mean, I'm probably the healthiest 68-year-old she has in her practice. I'm not on any medication except for my hormones. But
Yeah.
why can't the dots be connected? It was mind blowing. And that's
Yeah,
what
it's
we're up
very hard.
against. Yeah.
Yeah. And I mean, it's funny, like I'm with my practice and really I just graduated January. So it's just been, I've just new, but I've been practicing thermography and health coaching for 10 years. So,
Okay.
these conversations have always been there. And so furthering myself was just be like, there's questions I need answered, like people, I
Yes.
have to be able to answer things
Yes.
correctly.
Yes.
Um, but it's just like, so many women that I have as clients right now are like heart disease, blood
Oh
sugar,
yeah. Oh
insulin
yeah.
resistance.
Oh yeah.
It's just so difficult. And so I'm stepping back and making sure that I'm holding them like, not being their cheerleader. I don't want to say hold them accountable. I'm being their cheerleader, trying to get them to breathe and to chew and to move and to, you know, please take the medication so that it balances, and then we can get your nutrition up, and then we can talk what they, because they're like, I'm so tired of being on medication. I'm like, okay, but there's just too much going on. Your inflammation's too high. There's just so much. And then I get their hormone test back. So I may not do the Dutch test. Maybe I'm just
Mhm.
doing the saliva hormone panel. And
Or
it's
blood.
just like,
Or blood.
yeah,
Yeah.
or blood. And
Yeah.
it's just like, okay, well, that says a lot.
Oh yeah.
Their cortisol is either like all over or there's no cortisol. They're just flat,
Oh yeah.
whoa,
Yeah.
like this.
Yeah.
So it's just trying to get them back to a balance of things so that when, it comes to like, yes, they need estrogen. I can see that,
Mhm.
right? But throwing it into the fire may not be the most wise advantage. So let's take our time, balance out our blood sugars, let's manage our stress and take a breath, and then start having that conversation.
It's all those things. And like I said, I used to say, we have the layered cake, right?
Right.
And those are all important components. But here again, and I'm watching it again and again. I'm watching it with my own clients in my own practice that sometimes because estrogen does affect metabolic health and
Mm, yeah.
inflammation markers and all of that, it's like sometimes we need a little bit of it in order to start turning that ship around. But we still
Interesting.
can't, yeah, we
So then
still can't ignore. Mhm.
how are you having that conversation with them to get their doctors on board? Because that seems to be the thing. It's like
Yeah.
they're on this, they're on that, inflammatory markers are high, they're those things. And yes, we know that it's important for every single part of the body. There's estrogen receptors everywhere. You need
Mhm.
progesterone, you need testosterone.
Mhm. Mhm.
But how are we going to start that conversation with practitioners, with their medical doctors?
That is a really good question, and that's the one I'm kind of on a
You're
got my
stewing.
torch. I've got my torch out here, you know. Um, I'm on a crusade about, and I'm still
Beautiful.
trying to figure out some of those, and that is where I will even send my clients to the online, um, services because they're not that expensive,
No,
and then I monitor them and help them and guide them. So I help them with all the rest of the stuff that the online just are not, that's not what they do. And yes, they'll have to pay out of pocket for their hormones. But if we can do that and then watch the markers change, sometimes we can get the doctors on board with
right.
that.
Right. That's
It,
very interesting. I'll have to start studying that and having these conversations
yeah.
with my clients because everything they've done doesn't change
Yes,
except the hormone.
I know. I'm sorry. And I didn't used to be quite as adamant, but sorry.
No,
I'm looking at it. I can't
it's the
ignore
proof is
it.
in it's so much food alliteration here today. The proof is in the pudding.
Yeah,
You
it
know, and it's
is.
just like,
And I've got a
is the
really good healthy recipe for pudding, by the way. Yeah, I do on my
and it's
website.
like we're talking about you used to have it as a cake, and I'm thinking to myself, well, now it's just like a beautiful stew, and the estrogen and hormone replacement is like the umami, where it just
Oh,
sets it apart,
I like
right?
that. It
Very
pops it.
exciting, right?
It pops it. Food
It
alliteration.
really
I love it.
So we had started the conversation about you. We were just about to talk about osteoporosis, and you know
Mm.
that you were adamant about that. So let's just talk about that for a minute and how important it is, and what happens when we start adding the estrogen, testosterone into the mix, and then where does that resistant exercise, weight resistant, or lifting weights play a role with or without estrogen?
The weight resistant is with or without it. I mean, you have to do it. You
You have
just
to do
do,
it.
and you have to have adequate amounts of protein too. And you also do have to manage your stress because it just leaches our bones of all of our
Yeah.
minerals. So it's all of that. And here again, you can't just pop on the estrogen, okay, or the progesterone and testosterone. You can't. So you need to be doing all those other things too. And if you choose not to do HRT, um, if you're not losing bone, I'm gonna be hands off. Just like you're doing great, your body's doing great, and genetics does play a role in this, okay? But if you have osteoporosis in your family, if you have some of the other risk factors, which I don't think we have time to go into that, growing up or use of inhaler steroids, okay, that leaches the bone too. So we can have layers of risk. um, Underweight, okay. If you're underweight, you're not making enough estrogen when you're younger. If you're an elite athlete, I mean, there's so many different things when we're younger that can lead up to it. And then the genetic part of it. If your genetics are good and everything else is good, you've got a good baseline, I would say, and you don't want to do hormones, and your DEXA comes back good, and you're doing the protein, you're doing all the other stuff right. If we don't need to fix it, we won't fix it.
Right.
Okay. But that's one of the biggest things I come see in my practice is women who have osteoporosis. I mean, it's again and again and again.
Yeah.
And, they could be eating protein, enough protein, and, being fairly active. I see that too. And we're still not getting to where we need to be. So it depends on the woman, but I'm just seeing it an awful lot that unless we have hormones in there, we're really at a loss here.
Right.
And, what women need to understand is, why does estrogen help? Well, we have osteoclast, which breaks down bone, okay, which we need to remodel our bone. So that's
Yeah.
part of bone remodeling. And then we have osteoblasts that build it up.
Right.
And the estrogen really cuts down on that osteoclast, so the breakdown of the bone, okay? And progesterone and testosterone both help build up the osteoblast. Now, DEXA scans are important, but I like my clients also, especially if we're showing osteopenia or bone loss, I like them to have two lab markers so we know what's going on. We can see whether or not there's a lot of bone breakdown or if the
Hmm.
problem is not enough bone buildup or combination of the two. So there's something called CTX, that's the short name. I don't even remember the long name for it. And that will give you an indication of the bone breakdown. Okay.
Did you say CTX?
CTX. And there is
Hmm.
a longer name, but usually if we say
Yeah.
CTX, they can figure it out. And then there's P1NP. So Paul 1, Nancy Paul. And that looks at the osteoblast activity.
Interesting.
Yeah. And, I just had a client that came back and, she's got osteoporosis. We had she had a lot going on. But one of the things I had her do is I did have her do those two tests, and her CTX came back high. It was in 650 or higher, and we want you to be closer to 350 or lower.
Right.
So, but her osteoblast was really good. So thank God.
Yeah.
And she was on HRT.
Hmm.
Okay.
But there was too much stress going on.
Well, not only that, she was on
Yeah.
pellets. And so, been on pellets for a long time. This is a whole other conversation. But what can happen is your body produces something called sex hormone binding globulin. And with pellets, because you're getting such a big load at once in the beginning, it can raise that. So it'll globs onto things. Okay. There were other things that contributed to this too. But it was really nice to see where we needed to address it.
Right.
So we needed, yeah, we needed to do a lot of different things, but it was good to see that. So yeah.
And osteoporosis, it just isn't about calcium.
Oh God, no, no, no. Calcium's like the. I mean, we can get most of us can get enough calcium through our diets. No, it's vitamin D, vitamin K. It's putting stress on the bones, so our muscle mass really makes a difference. We already talked about stress. We took, sleep's part of that too. So just overall, um, health is really important. I was going to say something very, I don't know what, but I think we kind of, I don't know if women realize this and or people realize this is that, we think about osteoporosis, we think about, a broken hip, right? A hip replacement. All right, inconvenient, yeah, but no big deal. But guess what? It is a big deal because 1 in 3 women over the age of 70, it might even be younger, will not make it past their first year. And it's not because of surgery itself, it's because of, the recovery period in time and what happens to the body. So she's going to be more prone to pneumonia, more prone to UTIs, which older women are, and they often don't even know they have it. It goes to their brain, goes to their kidneys. And then you have this immobile time, and it's, most of these women are frail to begin with, and they don't
Mhm.
have a whole lot of muscle mass, and they lose it and they never get it back. So even if they don't die, their independence goes away.
Yeah.
And if nothing else, I mean, I always think I want to always be able to get up off the floor. I don't want to be immobile. I want my independence more than anything else, I think.
Right. It's so important. Your independence, but also mind. And then,
Yes.
so the mind aspect of things, even if you have the genetic disposition, right? So even to me, I'm really getting into the study of the DNA labs just so that you understand your instruction book from birth. And,
I
but
like the way
it's,
you said that. Yeah.
thanks. I like that, the instruction book from birth.
Uh-huh. Uh-huh.
Um, and not to negate that it's important to understand where you are now. So your hormone
Mhm.
test, blood work, all that good
Mhm.
stuff. But
Mhm.
to me, it's dementia. Like it's, I already forget stuff. So it's like,
Yeah.
yeah.
Yeah, the dementia and the Alzheimer's, the brain part of it, and I think we're seeing that increase in both men and women,
Well,
and I
and
think
it's because they were brought up on that, on a no fat margarine diet.
yeah, that
And
that's a big part of it, and then our toxic
then no
exposure
hormones.
and no hormones, toxic
No.
exposure, and yeah, and, you can reverse these things, but once you have it, it's a hell of a lot more difficult to reverse them because it takes work
Yeah.
to do it.
Yeah.
And, you can, but yeah, you don't wanna get there. Yeah.
I had a beautiful client yesterday, and she uses thermography just to sort of give her that full 360 view of where her progress is coming with her therapies, and what
Mm,
she needs to work on next. And one of her people, her specialist, says, you have dementia coming. You're at
mm.
about stage 2. And I'm listening to her, I'm watching her, I'm talking with her, and I'm like, I don't know about that. Find someone else, please.
Yeah,
So it's just like,
yeah.
oh, but I'm like, please talk to someone about hormones. Please talk to
Mhm.
somebody about,
Mhm.
prevention. Understand
Mhm.
where you are. And
Mhm.
just because your mom had it doesn't mean
Mm-mm.
you get to do it.
Mm-mm.
It's not dealt in
Mm-mm.
the cards.
Mm-mm.
And yeah, but I say to so many women, I'm like, please talk to someone about hormones because your brain needs estrogen.
It
Your brain
does.
needs fat. It needs protein.
Yes, it
It's
does. And it
terrible.
needs probably, mitochondrial help and it needs detoxification. I mean, there's a lot of different
It's a lot.
layers that no one can be expected to know unless you're you know, in this space. And even then, no one person can know it all. There's just
You
too
can't.
much to know. So you need a team. And, you know, I'm totally telehealth now, and I see people from all over, and I'm happy, to talk to any of your clients and patients.
Absolutely. Yeah.
And I do have a course. It's called Women of a not Women of a Certain Age. Sorry, it's called Grace. And that was my old course. But it morphed into this. Actually, it morphed into this. It's
Good.
called Grace and Transition for Women of a Certain Age. That's what it is. And it is an 8-week program, and we go over, everything we talked about here, but other things too, in a lot of depth. And it's done in a community, and you get one-on-one support from me. And, the whole purpose of me doing this was to give women a space where they could come and learn what they need to learn so they can have conversations, so they can be advocates for themselves. And at the same time, still get support from other women who have walked this and from me as well. And I wanted to make it affordable because this can get expensive. So in a group situation, it's, guidance and it's knowledge and it's all of that and an opportunity to make changes while you're in the group, right? And one little change here and there sometimes can, have a huge ripple effect.
Yeah.
So I have a new cohort. I don't know when this is going to air, but
It's
new.
it's it's actually live in a
Oh, it
couple of
is?
places.
Hi. I didn't realize that. Good thing I'm behaving.
Oh, it's
Um,
okay. I love it. I love it. No, I think it was in June your launch, correct?
yeah, the next one's starting June 15th.
Yeah.
So um, you can find out more information by going to my website, which is a livingbalance.net, not .com, but .net /course. and you can find out more information there. You can also download the lab checklist from that page as well. So yeah, there's different ways of getting help, just by going to my website. And I do have recipes on there.
Perfect. No, I think it's important. And having it from a group aspect certainly
Mm.
helps women know that they're not alone,
Yeah.
and they have this safety net
Hmm.
and a community of
Hmm.
very like-minded women. And that's why it's so important to create that sort of aspect. And then if they need individual help, then of course that's there.
Right.
But so many things can be discovered and learned just from an online sitting down with a cup of
Hmm.
tea, learning about yourself, learning the new language of
Hmm.
how to talk to the different practitioners, that
Hmm.
it's not 60 and done, or 70 and you're
No.
done. It's not this aspect. And it's learning the language and of estrogen,
Hmm.
testosterone, and progesterone
Hmm.
past menopause, right? So
Hmm.
it's
Hmm.
because it's we're just talking about all this now. You
Yeah.
weren't allowed to.
No.
We knew, but we weren't really allowed. So
I don't even know if we knew so much after the WHI, because there was
yeah.
no education, because it caused cancer. So why even talk about it?
Hmm. Hmm.
They were bent on finding drugs to help with all of these things. And so, yeah, the conversation stopped. And, sometimes we don't know what we don't know. And that is another part of a group too. Sometimes we don't know. We hear it from somebody else and it's like, oh, hadn't thought about that
Wonderful.
one. Yeah.
Wonderful, Cindy. This has been an absolute pleasure. Thank you so
Likewise.
much. Yes.
Thank
So
you.
I always finish with one thing. What is a word of wisdom that you hold yourself true
Mm.
to? Not just a word, but, phrase you've hold.
Two words probably, or a couple words. One is take a breath.
Mhm.
Two, stay curious.
Beautiful.
Yeah.
Yeah. Very nice. Very nice. Thank you so much. So,
Thank you.
everything will be found for Cindy in the show notes, and in Facebook. I will add all that information there. I thank you so much for being part of this. I think this was a brilliant and amazing conversation today. I hope you enjoyed it.
I
And I
did.
hope at some point there, we have given you some really great insight in helping you go from fed up to faith fueled, helping you to become the wise divine women that you've been called to be.